Thank you. Well, thank you very much for inviting me to come and talk to you today. I was asked to set the ball rolling for this debate by talking about how the Animal Welfare Assessment Grid can measure quality of life and be implemented in practice. I'm also going to add in some things to try and stimulate some discussion later on when we get to the debate part. And I'm conscious of the fact that some of you will be saying, what on earth is the AWAG? Because you've never heard of it. Some of you have done, you've heard me present about this before, but for those of you that haven't, the AWAG is the Animal Welfare Assessment Grid. This is the first publication back in 2010 that we did with the concept of it. And what it is a basic welfare assessment grid like this, with a score of 1 to 10 on each of 4 axes. The first axis looks at the physical condition of the animal. So you look at its clinical condition, and we score various factors, which I'll talk about in a moment. And you give it a score of 1 is normal, 10 is grossly abnormal. So the bigger the score, the worse the animal's welfare. The next axis is the psychological axis, where we look at behavioural deviations reflecting the animal's psychological well-being. Again, 1 normal, 10 grossly abnormal. The next axis looks at the quality of the environment that the animal is in, so reflecting any suffering due to poor husbandry. So looking at the environment in which we keep this animal. Is it in a little cage? Is it in a big open pen? Is that what it wants? What are we keeping it in? And then the final axis looks at procedural events and the impact on the animal. So these might be experimental events, which is what we designed the system for in the first place, but also clinical events, what we are doing to this animal as vets. So reflecting the suffering due to any concurrent illness and whatever's going on. So you might be taking the blood sample for the benefit of that animal to make a diagnosis, but you have to restrain it, you have to take the blood from it. What impact is that having on the animal's welfare? So you end up with a quadrangle like this with your various scores, and you measure the area of that quadrangle to give you the cumulative welfare assessment score at that moment in time. So just to reflect for a moment, of course, welfare, you all know, is defined according to the 5 domains, and the grid parameters reflect those 5 domains. So the physical axis looks at nutrition and health, psychological axis, behaviour and mental state, the environment is there, and what you're doing to this animal procedurally will be affected by, for example, nutrition, if you've withheld food and water, the environment, if you've kept it in a particular type of recovery cage, and that might affect behaviour and mental state and so on. So those 4 parameters are reflecting the 5 domains of welfare. But what's important is the duration of whatever it is that's happening to this animal. So often we look at an animal's welfare, it will come into the clinic and you'll look at it and you'll assess it and you'll make a judgment at that moment in time. How long's it been going on? How long is it going to go on for? When are you going to see it again? Next week, next month, next year? We tend to look at welfare at single moments in time. What we want to look at is the animal's quality of life and get some sort of lifetime measurement of what's going on. Is it getting better? Is it getting worse? So the AWAG illustrates the temporal component. So over time, look at the area of the quadrangle here and then measure it again. And in this example, the animal's environment changed, the behavioural deviations improved, the clinical experimental events were the same, but you can see the welfare improved as the size of that quadrangle gets smaller. So by measuring the cumulative welfare assessment score, and this is just a made-up example using some of the software we're in the process of developing, you get the cumulative welfare assessment score over time, and then you can click on it at that moment in time, and it comes up with the grid for that moment in time. You can click on the grid, and that will give you the factors that you've scored to give you that assessment for that axis. So it allows you to drill down to the specific elements that are making up that animal's impact on the welfare. So for example, here we've got response to catching events scored 6. So we can go, oh, hang on a minute, that's scored 6. What can we do to improve it? Can we improve the response to catching by, for example, training it using positive reinforcement training rather than lassoing it or something like that? Depends entirely on what you're doing. So in this one here, for the environmental factor, we've looked at housing. Housing has scored 6. Well, can we improve that? Can we improve the housing? It lets you drill down to the things that are actually having an impact on welfare so you can do something about it. So the first step when using the AWAG is to identify what factors you score for each of those 4 parameters. And it depends very much on the species you're working with, the type of use, what records are being kept, what samples have been routinely taken anyway. And you need a team approach to define those factors, which is one of the huge benefits of this system because it gets people talking about welfare. It makes people think about welfare. What can we do? What can we score? What can we look at? How can we do it better? So just some examples. On the physical axis, you might be scoring weight, body condition, doing a clinical assessment. But I must stress here, we don't want invasive techniques just to measure welfare. There are lots of things you can measure for welfare scientifically, looking at blood samples to look at hormone levels, looking at telomere length, all sorts of things. But we don't want to be taking samples, impacting on the animal's welfare and going, oh yes, look, it was okay, until we actually took these samples and then we had an impact on the animal's welfare. So, they have to be samples that you're taking anyway. On the psychological axis, we can do behavioural measurements, look at incidents of stereotypy, dominant status, user behavioural ethogram, these sorts of things. And for the environment, you can consider the amount of space available, the level of three-dimensional activity, what the animal can do, what level of enrichment is provided. Depends very much on the species you're working with. And then for the procedural events, think about the effect on the animal, even if you are doing it for the animal's benefit. The animal doesn't know that. It's not giving you consent. It's not understanding that this pain and suffering it's going through is because then my leg's going to get better and I can run around. No one explained that to it. So assessing lifetime experience, we validated the AWAG by looking at data on primates using TB vaccine studies. So it looked at the suffering of the animal due to the experiments plus any clinical events and their housing and husbandry, thinking about whether these harms added up over time, and in order to identify which refinements to their housing and husbandry and experimental techniques actually made a difference to welfare, because so much of this can be, yes, I put this enrichment in. Well, that's not really enrichment. What really makes a difference? And also to decide when is euthanasia appropriate. And then we can look at the harm-benefit justification for that animal's use and say, does it still apply? Because we're actually getting a measurement. But of course, the quality of life of an animal doesn't really just depend on which sector you're using it in. So the animal doesn't say, oh, I'm a lab animal, so that's okay, because I'm doing this for the benefit of human beings. Aren't I brilliant? It doesn't make any difference to the animal. Because the animal's perception of its welfare isn't affected by the reason for its life or the cause of its suffering. So the first question we have to ask is it acceptable for animals to suffer? In the example so far, in the name of scientific progress, so we do a harm-benefit analysis. What about because of owner ignorance? Because they just think it's really nice and cute and cuddly and they just want it. Or to produce cheap food, because that's what we want. Or to undergo major surgery. And if so, how much suffering and for how long? And of course, making those decisions is the function of ethical review processes, regulatory bodies, that's what regulations are there for. But the success of those things depends very much on the culture of the institute in which you're working, the resources the regulatory authority has to actually make decisions and do something, and on society's values. As we've just heard, society's values are changing and moving all the time. So whatever the animal's use by society, we have to think, is it still fit for purpose? Is that total level of suffering justified by the benefits that are coming from that animal's use? Remembering, of course, that most farming systems do restrict normal behaviour. And of course, as in the example here with these chickens, of course, high productivity doesn't necessarily equal good welfare, so you have to think what you're measuring. And we need an objective measurement so that we can justify if reduced quality of life is okay and is acceptable. So there are wider applications for the welfare assessment grid, and we've used it now in other veterinary sectors apart from laboratory animals to evaluate lifetime experience. We've used it in zoo primates and in wildlife park birds to see whether we could use it on groups of animals rather than just individuals. That's been published in the Vet Record last year. And we've also done studies now on zoo carnivores, on the large herbivores, giraffe and scimitar horned oryx. We're doing it in some equine species, rescue dogs, the Blue Cross, and also some dairy cattle. So we're evaluating this and using pilot studies to define the factors that you score. So for example, with horses, what factors would you score when you're trying to decide? The video is supposed to be going, and there it is, yes. So for example, here's this horse Shadow, and how often do you see owners go, oh, Shadow, he's really cute, he does this all the time, isn't he sweet? Stereotypic behaviour, is it recognised as abnormal? So also with horses, for example, you can score pain face. The picture here is of a horse that has a twitch on its nose, and if you look at that, you can see the pain face, you can see the stiffly backward ears, the orbital tightening, the tension above the eye area, the strained chewing muscles, and so on. The twitch has been on for 45 minutes very tightly. That animal is just being clipped, using it totally inappropriately. And then what about the environment? What factors would you score? Again, for a horse example, horses, of course, are afraid of confinement. They've evolved to live outside in the open plain and run around. And both isolation and confinement can be stressful for horses. So the picture there, we've got a lovely big field, it's really nice, but if the horse is on its own, is it going to be having good welfare if it's on its own? On the other hand, if it's in a paddock with its friend, that's great, but this one here, picture was taken in the summer, it's got barbed wire fencing, in the summer it's dry, in the winter knee-deep in mud, so you've got lots of deep mud that it's going around in. So you have to think about all these different things when you're scoring the environment. So if we carry on with just the horse theme for a moment, here's a horse sitting there, it's got bandage on, sitting in the stable like that. You might want to assess its welfare at this moment in time because you're treating this as the vet, doing everything for it, because you want to restore it. I know it's not the same horse in the picture. You want to restore it to health and running around doing all the things we want horses to do. Now, if it's in an acute condition, this horse has acute laminitis, you can see there, it's not a happy horse. Or we could end up with a chronic condition rather than acute. How long is it going to go on for? How are you going to score the welfare of that animal? And how do you score the welfare of an animal like this? How can it get back to normal behaviour? How much is that going to impact on the animal's welfare? Remembering it never signed a consent form. So environment, is this enrichment? A lot of people will say to me, yes, this animal's got enrichment. We have an environmental enrichment strategy in our facility. We've given it, it's got a ball, it's got some treats in here, it's got a tube to play with. That's not enrichment. The most enriching thing for that monkey is the fact I opened the door to take the photograph. This is enrichment. So here you can't see the whole area here, but it's a big area and the animals have a water bath. That's Johnson's baby bubble bath, so they have nice clean coats as well. There are peanuts at the bottom. And these animals are living in a group, so they can go in there. Their time budget, instead of just sitting there doing nothing, they can go in there, they can find the peanuts, have a little bath, swim around, dive in it. But actually the important thing with this is the animals are group housed. And this bath allows them to establish their social hierarchy in a non-confrontational way. So the incidence of wounding goes down. So you end up with less wounding, less incidents of that sort. They have a much better time budget and they have proper enrichment. And it matters not just for animals like this. So 2 Labradors, they've gone for a walk, they're down by the river. This is what they think is great. I have to admit they're my own Labradors. And they love going down there and playing in the water. I'm not forcing them to go in the water. They choose to go in there, but they absolutely love that. Now, how often do people bring dogs into your surgery? This is from The Dog Day by Amelie Rand, and because you can't read the text at the bottom, it says, "What now? We've stopped. The park's just there. I've been so good, this isn't fair." And yet they bring the dog into the surgery. "Oh, yes, he goes for walks every day. That's fine. He's on the lead, and I stop and chat to my mate, and then we go home again." So what sort of environment is that? How does that impact on the animal's welfare? So welfare in general practice. It's not just about health and disease. Vets tend to think health, disease, I've got to make the animal better. So if we think about companion animals, think of the number of brachycephalic dogs that are around now. The number's going up and up and up. They're very popular. How are we going to measure the quality of life of these animals as that population gets older? As they go down with obstructive airway syndrome and lameness, we need some sort of objective measure to look at quality of life. So can the AWAG be used as a routine tool in practice to look at the temporal component of suffering? It will give you a visual illustration of quality of life and therefore enable good decision making. When should we put this animal to sleep? Should we carry out this surgical intervention? Should we put the animal on keep and therapy? How do we anticipate this animal's welfare is going to improve or not improve? As a vet, as we've heard, your constant endeavour is to ensure the health and welfare of the animal committed to your care. It's not just about making it better and health. Animals, remember, aren't going to give informed consent. The AWAG will also allow you to give owner support because it will give you a pictorial illustration of this animal's welfare and how it's deteriorating if some other intervention needs to take place. And it will also, of course, support the vet in making those decisions. Mental health issues are a big problem for the veterinary profession. We need to recognise that, and we need systems that will support decision making, which can be difficult, particularly if you've got owners that maybe don't agree. So in practice, what tends to happen is the animal comes in your first opinion practice, you assess it, you diagnose it, you outline some options, and you treat it and intervene. Or maybe you wait and then treat it and intervene, or maybe you treat it and then wait, and then you refer it to a specialist, or maybe the other way around. But all these various combinations is what happens. Or maybe you put it to sleep at some point. And all of the things and the order you do them in depends very much on the client's wishes, how much money they've got to spend, and also the vet's own particular area of interest and expertise. And that's how the decisions tend to be made, rather than looking just at the animal's welfare and what's best for the animal. And also, sometimes those decisions will be made to prevent negligence claims. Well, I think we should put it to sleep, but actually I'm going to refer it on because I'm not quite sure and the owner's going to be a bit difficult, and perhaps I need to refer this up to some specialist. And so you're preventing a claim of negligence against you, and we're trying to be a bit careful. And this question, of course, will come up. Is it insured? So is this a carte blanche to do more when the answer is yes? Social media, of course, has an influence. And it's surprising, I had a discussion with someone the other day, totally unrelated to any veterinary discussion, but they happened to come up with, they were talking about their dog. Oh, I spent £5,000 on my dog. It's almost like they've gone and bought a new car. It becomes a sort of indication of how much money they've got to spend. And just because we can, should we be doing things? What level of orthopaedic intervention should we do to these animals? Should we be setting up hospices for dogs? And one medicine, of course. Does this mean we should treat animals like humans? So this is an example that was in the Veterinary Times a little while ago. This is a case study that was published in the public domain. It's a poodle. It's aged 14. It was an RSPCA case. The fur was matted around its front feet, so the blood supply was cut off and they had to amputate the front feet, and it also had rotten teeth. And so its front legs were amputated, it was put on a frame like this, it was 14 years old and now had to be found a new home. So it had a complete change in environment, change in social structure, and had the surgery, and now had to go around on a frame. Is that ethically acceptable? Is that animal's welfare really what we're protecting there in doing that surgery? So with One Health, we have to think about ethics and the harm-benefit assessment. And the first question to ask is the work you're doing recognised veterinary practice? Or is it experimental? Because we're moving into areas now where some things maybe are not recognised veterinary practice and that not everyone would want to do them. Of course, if it's experimental, then it comes under Home Office regulation, requires ethical review and good experimental design. The RCVS define recognised veterinary practice as procedures and techniques performed on animals by veterinary surgeons in the course of their professional duties to ensure the health and welfare of animals committed to their care. And anything that is clinical research should be going to the RCVS Ethics Committee for discussion. In America, they've adapted a clinical consultation committee to resolve these dilemmas in referral centres. And we also have to think about the reputational risks to the profession. A survey by vet festivals showed that half vets do not feel respected by the communities they work in because they're of a misconception about us being money grabbers, high fees and all that sort of thing, and a lot of social media criticism. Is insurance and the cost of these things driving that thought? And an ownership report by More Than showed that insurance premiums will continue to rise, and they feel that pet health and well-being should be added to the national curriculum and that we must encourage owners to keep their pets healthy. Now, I'm sure you're aware of the fact that for young drivers, they can have technology in their cars to check that they keep below certain speed limits, and that reduces their insurance premiums. And of course, there will be opportunities with new technologies to track the activity of animals' food intake and their welfare. And that can lead to incentives-based insurance premiums rewarding those owners who keep their animals well. And then we might get some changes in behaviour. And More Than said, if not, the futures of the nation's pets will look increasingly bleak. So the outcome of using the AWAG is that in the future it can link to new technologies to generate big data on animal welfare, to inform policymakers and drive better attitudes and investment in this area, because it gives a visual representation of welfare and encourages communication and allows you to drill down to those separate components. And then ongoing refinements can be targeted at the specific elements to improve or prevent deterioration, because what we're aiming for animals is preferably a good life, but if not, at least a life worth living, and one that we can be proud of as veterinary surgeons to support. Thank you for listening. I must acknowledge Public Health England, who provided funding for this study in the first place, and now to NC3Rs, who are providing funding to develop the software for this system.
Thank you, Sarah. Thank you. I think the reception of that speech is indicated, well, the very welcome reception of that speech is indicated by the number of questions that have come up on my piece of technology here. The first one is, in the AWAG, if only one axis is very high, might it not produce a small overall score where one criteria is really unacceptable?
Yes, I mean, the AWAG is not a perfect answer. It's not going to give you the answer to everything. And obviously what you have on one axis will affect the others. But quite often, things that you're measuring will affect more than one axis. So if you're looking at, for example, supposing you reduce diet, you'll have a reduce in the physical condition. You'll maybe have a change in its behaviour because it's looking for food. Maybe you've got it in a restricted environment, and also you'll be carrying out procedures. So a lot of these things will be affected simultaneously. If you have one thing that's really, really bad for that animal and giving you a really, really high score, you lose your clinical judgment, you know.
Greg Dixon asks, can AWAG be used to make comparative welfare judgments between species and systems, or only within them?
No, you cannot use it to compare. You can't say, my monkey's better than your mouse, or whatever, because you're scoring different things. What you score has to be appropriate for the animal that you're dealing with, for the species you're dealing with. So what you score for a horse will be different to a rat, will be different to a mouse, will be different to a monkey, will be different to a dog. And you can't use it to point score off somebody else.
How long does this model take to assess individual animal welfare? Is it something which is feasible to put into place in practice with short consult times?
Hopefully it will be when we've got the software sorted. At the moment, we've been doing this with Excel spreadsheets, which takes a long time. Public Health England were brilliant in that they started putting some software together, but it was not very user-friendly. So now we've got funding, which we've just got in the last couple of weeks, from NC3Rs to develop the software, which hopefully will make this a lot more user-friendly, a lot easier to use, and then we can tailor it to different species and different uses within general practice and such like.
How do you feel about chemotherapy? I mean, you mentioned chemotherapy in your presentation, Sarah. How do you feel about chemotherapy used for pets? Lots of side effects which can't be explained to the pet.
My feelings are irrelevant to this discussion. I think you need to think very carefully about... The side effects vary between individuals anyway. I mean, there isn't a one-size-fits-all with these things. And you need to assess the animal, look at the welfare, and think about the time frame. And think about, you know, if I'm going to go on chemotherapy, if I had some problem now, I will be thinking, well, I really want to live because I want to, you know, see my grandchildren grow up and all that sort of thing. Animals don't think in those terms. They'll be thinking, this really hurts and I feel rotten today. If it's going to go on and on and on, and the chances of survival are not good, is that the right thing to do? If, on the other hand, it's short-term, and they maybe are, I mean, chemotherapy is not such a good example, but maybe an orthopaedic intervention where you've got a young animal that's then going to have 8 or 9 years of normal life running around and behaving in a normal way, then maybe it's worth a short-term intervention. But if you're going to have an animal that doesn't have a good quality of life, is it the right thing to do? Think of the number of times people come into your surgery and you're putting an animal down, and the number of times they say to you, I wish someone could have done this for my mother or my father or my sister. You know, we've got that opportunity. Let's not throw it away just because we're doing everything we can.
Thank you. Going all over the place, sorry. It is often said by those who keep non-traditional species that if they breed, their welfare must be okay. Do you agree?
Sorry, say that again?
It is often said by those who keep sorry, it's jumping around a bit, non-traditional species that if they breed, their welfare must be okay. Do you agree?
I think the ability of an animal to engage in the behaviours that it's required to breed doesn't necessarily mean that their welfare is okay. I mean, look at, you know, battery chickens producing eggs. And No, it's a short answer.
Are some television programmes unhelpful in public understanding of animal welfare? I really like that one.
Say that again.
Are some television programmes unhelpful in public understanding of animal welfare?
There's a lot of television programmes about animal welfare, and I think that David Attenborough has done a lot.
Thank you very much, Sarah. There are other questions, but we have no time, so thank you, Sarah. Thank you.